If you struggle with binge eating, you'll know that binge eating takes a significant emotional toll. But are there potential risks in the short term and the long term for your health? By the end of this video, you'll have a better sense of the common binge eating disorder risks that may affect you. Managing an eating disorder can be a lonely journey. For tips and strategies for managing your eating disorder, subscribe to the channel and hit the bell in the corner so you're notified when I post a new video every Wednesday. My name is Meredith MacKenzie of Parallel Wellness. I'm a registered clinical counselor, eating disorders therapist, and doctoral graduate student. In my work with hundreds of clients with eating disorders, I've helped them to loosen the grips of their eating disorder, to live with freedom from food and compensatory behaviors. Now it's your turn. Before we get started in this video, I want to provide a quick disclaimer. While I am a registered clinical counselor and I have a lot of knowledge on eating disorders, this video is for informational and educational purposes only. If you are concerned that you may have an eating disorder, please reach out to a registered professional today. When I started planning this video, I really struggled with what to include. The majority of the information that I did find on the internet talked about binge eating disorder and really connected it to obesity and the health risks of living in a larger body. But I recently made a video on common eating disorder effects on health, and I wanted to be able to provide something similar for those with binge eating disorder. Because binge eating is often associated with weight gain and obesity, I didn't want to continue this stigma. I felt like including some of those better known risks of obesity and weight gain would only serve to continue to perpetuate the stigma of binge eating disorder and fat shaming. That's not what I want to be doing with these videos, and not at all the feeling that I want to have for this channel. So I won't be including those specific risks here. I also want to set a bit of context for this video with some statistics. In 2014, a study was completed with first-year medical students, people that are fresh to the field and could be your future doctor. And in this study, they found that 36% of medical students believed that being fat was that person's fault. And they also found that 60% of the students believed that some people are fat because they have no willpower. And because of this, they believe that their patients won't be compliant with whatever recommendations they make medically. This is a huge problem in our society, especially our medical field. When clients and patients feel as though they're being discriminated against, they don't trust their doctor. And when they don't trust their doctor, they're less likely to follow through on the recommendations. And this research found that there's a 60% increase in mortality risk to people on the receiving end of weight discrimination that can't be accounted for by their weight or their body mass index. So often we hear things in the media or we read things on the internet that really talk about health risks being related to being in a bigger body. And I want to use this information from this research study to show that the 60% increase is a huge amount, and it has so much to do with how we're socialized and how we treat the people that we work with. So now that we have that information in context, let's talk about some of the risks of binge eating disorder effects. The first risk I'm going to talk about is dermatological effects. Now, the challenge with binge eating disorder is that at times, many people restrict what they're eating and restrict their caloric intake. And then at other times, because they're engaging in binge eating, they're eating foods that have a lower nutrient value, but that meet the need for that particular binge eating episode. As a result of all this, you may experience dry, flaky skin, dry, brittle hair, and at times your hair may fall out as a result of binge eating disorder effects. Now, the gastrointestinal system runs throughout your entire body from your mouth to your anus. And obviously, with an eating disorder, your gastrointestinal system will be affected. Following a binge, when somebody has eaten a large amount of food, they can often feel sick, uncomfortable, bloated, and really feel the stretching within their stomach area. This can result in abdominal pain and nausea. Beyond those sensations that you're feeling within your abdominal area, when people binge eat, they typically eat foods that are high in sugar, high in fat, high in carbohydrates. And it's not that we want to label these foods as bad or wrong or that you shouldn't be eating these things, but when you eat large amounts of them all at once, it can be really difficult for your digestive system to digest that much food. As a result, you might feel low energy, sluggishness, and overall sleepiness. And this is something I hear from my clients often, that they have plans or intentions to do something with their evening, and then because they have a binge, it's really difficult for them to carry that out, and they end up canceling everything for the evening. Depending on what you're eating during your binge and because of the quantity, you might also experience acid reflux, cramping, heartburn, and diarrhea. Further down in the gastrointestinal system is our colon, and binge eating can cause a lot of issues in this area as well. It can cause constipation, irritable bowel syndrome, which is associated with chronic stomach discomfort. In the long term, binge eating also impacts the gastrointestinal system in a different way. In order to accommodate a binge, your gastric system might have to expand and stretch, which can lead to a semi-permanent stretching. It can also lead to gastric perforation because the gastric system is stretching so much that the walls of that part of your system are very thin, and it can be perforated, and then that can be quite dangerous if food is getting into the other parts of your body. Essentially, your stomach gets so full that it ruptures. And another issue that clients commonly talk about as they're in their recovery process from binge eating is that because they eat consistently large amounts of food, their stomach then stretches and accommodates for this food, but then there's that expectation from the body that you'll continually be eating very large meals, so you feel hungrier, even if your body typically wouldn't be that hungry. The next binge eating disorder effect that I want to talk about is how it impacts you on an emotional level. Depression and mood challenges are highly correlated with binge eating disorder. As I talked about in my video on the binge eating cycle, binge eating is often triggered by different emotional states that we're in, particularly when we're experiencing unpleasant emotions, whether that's sadness, frustration, disappointment, and overall stress. The problem with this is these negative mood states will trigger a binge, but then they also are the result of the binge eating. Because many people, once they're finished binge eating, feel a lot of shame, a lot of guilt, and they feel quite alone in those feelings. So it ends up becoming a cycle that's actually quite difficult to manage. This ends up being related to a person's self-esteem and how they feel about themselves, especially when we consider the stigma that's associated with binge eating disorder. Related to this are behaviors associated with social isolation and withdrawal. For one thing, binge eating behavior is often something that people engage in privacy and secrecy, so they're not letting people know what's going on with them. And binge eating can take up a large amount of time in a person's life. The other issue is, and as we've talked about the stigma that's related to binge eating disorder, is that people will have a much harder time with reaching out for help to their physician or their therapist because they're concerned that they're not underweight, that they don't appear to have an eating disorder, and therefore they don't deserve the treatment that's available to them. And because of that stereotype, people with binge eating disorder often suffer in complete isolation, all on their own without seeking the help that could really benefit the recovery from their eating disorder. So let's break the stigma that keeps binge eating disorder in such secrecy. Comment below and tell me, how has binge eating impacted your life? Let's create a supportive space within the comments. Binge eating disorder effects also impact the endocrine system. The endocrine system is responsible for managing your hormones throughout your body, and this includes insulin. When you binge eat, your pancreas goes into overdrive in order to accommodate and manage all of the food that's coming in, and it releases more than the normal amount of insulin at one time. In the long term, when your body is releasing large amounts of insulin, your body can develop something called insulin resistance. Essentially, the amount of insulin that's there is not recognized by the body, and so it has a harder time with managing the amount of insulin and food that's in the body. So the body doesn't really know what to do with all this insulin and all the food that you're eating. And this can actually be very harmful to your metabolism in the long term. The cells of your body will have a hard time absorbing the nutrients that you're eating. And it can also lead to a whole host of other medical risks, such as high blood pressure, heart disease, and type 2 diabetes. Binge eating disorder effects also impact your hunger and satiety cues for your body. What that means is because you're not listening to your body's cues for when you're hungry, when you're not hungry, and eating beyond that point of fullness, the cues that your body sends are all out of whack. And this can lead you to feeling hungry when you're actually not and causing you to overeat even more. Something that you might not recognize is that your binge eating disorder effects also impact your circadian rhythm. Your circadian rhythm is a system within your body that tells your body when it's time to sleep and when it's time to wake up. And for human beings, this is typically over the nighttime. Now, I didn't find this information anywhere, but I do suspect that this is because typically people will binge eat in the evening. It does cause so much physical discomfort, and you might be eating things with caffeine in them and sugar that really promote you to stay awake longer, but you also have that feeling of sleepiness and sluggishness, that the sleep that you're getting when you do eventually fall asleep isn't going to be good quality sleep. When you combine that with symptoms of depression, it also leads a person to sleep in later than typical. And when your circadian rhythm is off, it can also increase symptoms of depression. This can make it a lot easier to stay in bed all day, to want to comfort yourself with additional food, and it really just perpetuates the cycle of binge eating disorder. Now, and the final way that binge eating disorder affects a person's life is their social, financial life. This is a topic that the majority of my clients with binge eating disorder talk about within our sessions, how their binge eating disorder impacts their relationships with other people, their job, and even their finances, because binge eating disorder can be quite expensive. And because of this, a person with binge eating disorder might find it actually quite difficult to function in their normal daily activities because of the severity of their disorder. Now, in today's video, I tried to get away from the stigma that's often associated with binge eating disorder and talk about some of the effects of binge eating disorder that you might not be as aware of. And if you've liked this video and you're interested in more, stay tuned for next week's video that will be published on Wednesday, where I'm going to be talking about the causes or the why behind eating disorders. People always want to know, why do I have an eating disorder? And I'm going to provide you with some really interesting research information next week. If you're interested in getting started on your eating disorder recovery journey, I've created a mindful eating log that I use in my practice with clients all the time, and I've provided a link in the description box down below where you can go and download a copy for yourself. Use this as a tool to get to know your triggers for your eating disorder and what it is that helps you find balance in your eating. You're going to want to check out the rest of my videos on eating disorders and binge eating disorder, even intuitive eating. So I've provided a list of videos that you might be interested in watching in the description box down below, so have a look. If you've enjoyed this video, hit that like button, subscribe to the channel, and share this video with a friend or family member or anyone who you think would benefit from learning more about binge eating disorder. I look forward to seeing you in the next video on Wednesday.